and happening now. A number of new laws in Indiana are now in effect, and one of them changes some of the requirements for Hoosiers on the Healthy Indiana program.
Also known as HIP, that's the Medicaid program giving health insurance to Hoosiers. Many of the recipients work but don't have health insurance through their employer, or they don't make enough money to buy their own.
13 News State House reporter Emily Longnecker explains what this new law does and how it could impact more than 600,000 Hoosiers covered by the plan.
Well, Dustin and Felicia, the Healthy Indiana Plan is a Medicaid program that you said that covers Hoosier adults 19 to 64. Now, because Medicaid is run jointly by both the state and federal government, Indiana needs permission from the federal government to roll out some of what's in this law. That means parts of Senate Enrolled Act 2 don't actually go into effect today. But if and when that changes, critics of the new law say it could lead to thousands of HIP recipients losing their health insurance.
Eventually, I want to maybe become a legislator in Indiana.
He's still got a long way to go, but college senior Jimmy Freiberger has big plans.
And then maybe the president of the United States.
Right now, though, the 21-year-old from Richmond is just trying to graduate and support himself.
I do work. I'm a balloon twister in my communities.
What he makes isn't enough, though, to pay for health insurance. So Freiberger's on the Healthy Indiana Plan.
It's the reason I'm able to even make doctor's visits or dentist visits at all.
Recently, though, Freiberger says he got kicked off HIP briefly for not submitting paperwork he says he never received. He worries the same thing will happen to others because of some of the new provisions in a new law. Among them, a new provision not in effect yet that would require HIP recipients to provide documentation they're working or volunteering at least 20 hours a week.
We estimate that should this provision be implemented, hundreds of thousands, probably about 150,000 Hoosiers, could lose their health care coverage simply because the process of reporting and demonstrating eligibility is very labor intensive and prone to error.
Tracy Hutchings Getz with Hoosier Action was among hundreds who rallied this spring at the State House to protest some of the provisions in the then proposed bill. Another part of the new law, Hutchings Getz says the new administration was already implementing more frequent checks on HIP eligibility.
What we have heard from members is that, a bunch of data on an individual, might not always be accurate.
Hutchings Getz says that could slow down the HIP approval process, leaving Hoosiers waiting for coverage. Jimmy Freiberger says that's not as big of a deal for someone his age, but for others he knows on HIP who have serious chronic health conditions.
There is no conceivable way that without their Medicaid, they would be able to afford those medications that quite literally save their life.
Now, also something to consider, the federal government pays for 90% of HIP expenses in Indiana. The state picks up 10%. Those percentages could change with the state picking up more of the HIP tab depending on what ultimately happens with the Trump administration's big beautiful bill. And this past legislative session, Republican state lawmakers frequently talked about how much Medicaid expenses had exploded, even almost overtaking education expenses. And they talked about how something needed to be done to curb that growth, and this new law was part of that effort.
Yeah, no easy decisions there.
None.
All right, Emily Longnecker reporting. Thank you. And there are several new state laws now in effect impacting Hoosiers across the state today.
And we're talking changes to your taxes, as well as schools, and even the establishment of a commission to see if Indiana should take some counties from Illinois. There's a lot that goes into that law. We've got that online. Another one of the new laws raises the speed limit on I-465.
It's now increasing from 55 miles per hour to 65 miles per hour. There's a 65 sign, and that's going to be in most places. But keep in mind that it is not changing everywhere. And the Indiana Department of Transportation is starting to get those signs up on the interstate, but they are not all in place just yet.
You can read more about many of those new laws now in effect on our website. Just scan the QR code right there on your screen. It'll take you straight to WTHR.com/SeenOn13.